Hey everyone, and welcome. Today we're jumping into a really common clinical puzzle, the neck lump. Now, finding one can be pretty worrying for a patient, but if you've got a solid game plan, you can figure out what's going on way faster than you might think. So, picture this. A patient walks in, points to their neck, and says, "I found this lump." What do you do? Where do you even begin? Well, the journey to figuring this out doesn't start with some fancy, expensive scan. Nope, it starts with the basics. The very first step in solving this mystery is a good old-fashioned physical exam. Seriously, your hands and your eyes can tell you so much about the lump's size, what it feels like, and where it's located way before you even think about ordering any other tests. And out of all the things you notice, maybe the most powerful clue comes from a really simple question. Does it move? I mean it. How that lump behaves when the patient swallows or sticks out their tongue, that can be the key that unlocks the whole diagnosis. So let's talk about that movement. This isn't just some random test. It's a brilliant way to figure out the lump's origin story. Where is this thing actually coming from? Let's break down what that movement tells us. And it really boils down to two key scenarios. If you have the patient swallow and that lump moves up, you should immediately be thinking it's related to the thyroid gland. Makes sense, right? The thyroid is attached to the larynx, so it goes along for the ride. But if the lump moves up when they stick their tongue out, well, that is the textbook classic sign of a thyroglossal cyst. Two simple actions, two totally different paths.
Okay, so with that movement clue in our back pocket, let's dive into our first category, the cystic lumps. The easiest way to think about these is like little water balloons under the skin. They're fluid-filled, and each one has its own unique personality.
And our first suspect is the one we just mentioned, the thyroglossal cyst. This is a perfect example of a developmental hiccup. It's basically a remnant of a little tube, the thyroglossal duct, that the thyroid gland used to travel down from the tongue to the neck when we were developing as a fetus. And that old connection is exactly why it moves with the tongue. So the dead giveaways for a thyroglossal cyst are its location, it's usually right in the middle of the neck, and that classic upward tug when the tongue comes out. You'll typically see these in younger folks, people under 20, and while they're usually painless, they can definitely get infected and become pretty sore. All right, next up in our cystic lineup is the branchial cyst. Just like the thyroglossal cyst, this is another leftover from embryonic development. It just comes from a different structure, in this case something called a branchial cleft. Now this cyst has a completely different profile. It usually pops up in early adulthood, not in kids, and you're going to find it on the side of the neck. It'll feel like an oval-shaped, movable mass right in front of the sternocleidomastoid muscle. That big, ropey muscle you can see when you turn your head side to side. Our third cystic character is the cystic hygroma. This one is congenital, meaning it's there from birth, and it's a problem with the lymphatic system, which is a key part of our body's immune network. And with this one, the patient's age is a massive clue. I mean, look at this number. A staggering 90% of these show up before a child even turns 2. Most of the time, they're noticeable right at birth, often on the left side of the neck. And finally, we have the pharyngeal pouch, which is, well, it's a bit of an oddball. It's not really a true cyst. It's actually a herniation, a little pouch that bulges out from the wall of the pharynx. And you typically see this in older men. This one has, hands down, one of the most memorable clinical signs you'll ever come across. If the pouch is big enough to feel, you might actually hear it gurgle when you press on it. That sound is a huge clue. It's caused by trapped fluid and air getting squeezed out. How wild is that? All right, time to pivot. We've talked about the fluid-filled cysts, the water balloons. Now let's get into the solid masses. So instead of a water balloon, think of these more like a firm rubber ball sitting under the skin. We have to start with the single most common cause of any neck swelling, period. Reactive lymphadenopathy. That's just the fancy medical term for lymph nodes swelling up because they're doing their job and reacting to an infection somewhere. So, this means one of the first things you've got to ask is, have you been sick lately? A sore throat, an infected tooth, or even a virus that affects the whole body, like mono, can make the lymph nodes in the neck swell up as they fight it off. This is by far the most likely reason for a new neck lump. Now, for a more serious cause of solid swollen lymph nodes, we have to talk about lymphoma. And here, what the lump feels like, its texture, is a really important clue that can help you tell it apart from a simple infection. See, unlike the tender, sore nodes you get with an infection, lymphoma typically causes a rubbery, painless swelling. You also have to look for other clues around the body, like drenching night sweats or an enlarged spleen. Oh, and that rare sign about pain after drinking alcohol. It's a classic for exams, but honestly, you don't see it very often in real life. All right, let's switch gears completely to a vascular cause, the carotid aneurysm. This isn't a swollen gland or node at all. This is a bulge in the wall of the carotid artery. That's the major highway for blood going to your brain.
The absolute dead giveaway here is that the mass is pulsatile. You can actually feel a pulse, a heartbeat, inside the lump. And this is crucial. Remember our movement test? Unlike a thyroid swelling that moves up and down when you swallow, a carotid aneurysm is fixed. It does not move. That's a critical difference. Okay, phew, we have covered a lot of ground. We've gone from cystic to solid, from gurgling to pulsing. So now let's pull all these different threads together and create a simple, clear diagnostic map that you can actually use. Think of this as your diagnostic cheat sheet. Look how helpful this is. For the cystic lumps, the patient's age is a huge hint. Under 20, think thyroglossal cyst. Early adulthood, branchial cyst. A baby under 2, cystic hygroma. And that gurgling sound in an older man, that points you right to a pharyngeal pouch. Then for the solid masses, movement is king. If it moves with swallowing, think thyroid. A rubbery, painless lump should make you think of lymphoma. And that pulsatile mass that stays put, that's your classic carotid aneurysm.
And that really brings us to our final thought. You know, in an age of MRI and CT scans, it can be really easy to forget about the basics. But as we've just seen, simple observations, like how a lump moves, can point you directly to the right diagnosis. It's a powerful reminder that hands-on clinical skills will always, always be important. It's the art of medicine, and it shows that careful observation can be every bit as powerful as the latest technology.